There is an 80% chance you are being billed incorrectly by a doctor or hospital. How do you advocate for yourself in the U.S., which is the only developed country without a system of universal health care, and a significant proportion of its population lacks health care insurance at all? I'm a registered nurse, and I provide information on healthcare advocacy within the U.S. healthcare system. And today I will be giving some tips on ensuring you are not overcharged for what is already an outrageous system to begin with. First, did you know that among the 10 high-income nations, the United States spends the most on healthcare, and for that money gets the worst health outcomes? Also, Americans die 4 years earlier. In 2019, the U.S. spent almost twice as much of its GDP on healthcare expenses as other high-income countries. If you think you don't want universal health care, okay, because of health outcomes or the fact that it's not fair that your taxes go to cover other people's insurance, etc., it's already happening. How do you think private insurance works? The more people get sick and more people who spend money, the higher amount of dollars you are going to pay, regardless if you are ever sick. So do some research and make sure you are truly understanding the impact of not having coverage for all. No system is perfect, but right now we are the worst for high-income countries. Now, what can you do to ensure you are only paying what you have to? Explanation of benefits. Read it. See what the insurance states that you owe. Speak to the insurance if you are getting billed differently. What is the hospital charging? Did the MD actually see you? Take notes of who saw you and when. I have seen it 1,000 times. Saw a patient at bedside. No, they did not. Ask for an itemized bill. Research shows that up to 80% of medical bills contain errors, such as duplicate charges, charges for services you didn't receive, or incorrect billing codes, including upcoding, which is using a billing code for a more expensive service than the one you actually received. So please ensure you are looking at the explanation of benefits, itemized receipts from the hospital, who actually saw you, who didn't, and advocate for yourself with the doctors and with the hospitals.